And welcome to Akamai Seniors TV. I am Percy Ihara, your host, along with my co-host here, Angie.
Anjanette Wahine.
You okay? You call it Anjanette?
Yeah.
Okay. Anjanette. I call her Angie.
Everyone calls me Angie, but my name is Anjanette
Wahine Kapu.
Wahine Kapu.
And she's our co-host from the Big Island, but she's here on Oahu very often. So yeah, this is Akamai TV. As you know, our little website there, akamaiseniors.org is our website. In the future, we'll have all these TV shows on our website. It's been a little while. I will hopefully get all these shows on my YouTube channel, YouTube and / Percy Ihara. I have my own YouTube channel.
Good. When did you start doing that?
Well, the channel's been up since last week.
Oh.
So all these TV shows will be up there in the next couple of weeks. And then I have a new website for my reverse mortgage business called HawaiiReverseMortgages.com.
Right, and then you just started doing something new.
Well, I use AI cartoons. So I put on my Facebook page, my Instagram page, my LinkedIn page.
Yeah, having fun with that.
Yeah, it's just fun.
Good.
I mean, we're finding so many people today, and you correct me if I'm wrong, with your clients, that I would say more than half of my clients today, the children call me. Mm-hmm. So like last week, I talked to a guy, goes, how did you find me? He goes, oh, you're everywhere. I was also on social media, I saw your website. You know, when you Google you, your name's right there.
Yep.
So that's where I want to be.
I'm finding that with myself too. People are calling me, and I'm like, well, I think also it has to do with my last name, because whenever they call me, they're like, well, I saw your last name, Wahine Kapu, and I had to call you.
No, it's a great name.
Catchy. You know, I kept that. I kept my maiden name. Yeah. I love that name. I'm very proud of it.
So how's the Medicare space? I know there were some changes going on. You know, we had the president's speech the other day, the longest in history, by the way. Whether you like him or not, he's there. We have to deal with that. Right, Anjanette?
Mm-hmm. You have to.
But any kind of changes, I know he tried to did he get rid of Obamacare or stop it or something like that?
No.
But yeah, what are some of the Medicare changes? As you know, Medicare specialists here, I can't say expert, they said. Medicare special advisor.
Right, and we're a broker here in town. Yeah. I'm a local broker here for you. But you know, one of the things that has been happening, it's not brand new, Inflation Reduction Act. The first year that it started coming out, it was with the insulin, with your insulin, and it makes sure that it is affordable, right? Because the whole point of it is to make it affordable for our seniors, right? And then we had seen where they they got rid of the donut hole, so you don't have that donut hole anymore. I know that deductibles are higher, but they've gotten rid of a donut hole that used to keep you, that you would stay in until you got to like almost $8,000 out of your pocket, right?
So if you don't have Medicare, don't worry what she's talking about, because when you have Medicare, you know what it is. Trust me.
So when you have Medicare, prescription drugs are, of course, an issue, because it's not if, it's when you're going to start needing, you're going to have some health care things coming about, health needs. And so with your prescription drugs, it's been an issue, because prescription drugs are expensive. You know, I mean,
don't offer generic.
There was a time where Eliquis was like $1,000. I mean, now it's down to like $500, almost $600, and then they've come down even further this year, 2026. It's one of the 10 drugs that are, you know, brought down the cost for it, like their medications.
I thought there was a cap on the medications.
There is a cap for your total out-of-pocket cost for 2026 is $2,100. Now, I mean, that's wonderful, because it's like 2,000.
Yeah.
You know, what it was. I mean, I used to have seniors coming in and just at a loss of words of how are they going to pay for their medications, right?
Cut it in half, cut the pill in half. Huh?
Or not eat, right? Because they're like, you know, I got to pick up this medication. Do I take the medication or do I buy food? They're going to buy food, and they don't take the drugs that they need, right?
And so that's really happening in our community.
That really does happen, guys. I mean, I could see that. I mean, if I had to go out there and pay $2,000 for a drug, there's times where I might not take it. I mean, there's people that are underage that we don't take, you know, we kind of weigh out what we're going to spend our money on. But for 2026, there is a cap of $2,100, so you don't have to worry about that. There's, again, no donut hole, because they got rid of that last year.
It's $2,100 for the year.
For the year. So here's the deal, guys. As long as your medications are in the formulary, it's going to cap at 2,100, right?
But most people know what a formulary is.
Yeah, and if you don't, talk to an agent so they can look it up for you.
Talk to your local agent. I was telling you last month that you got to deal with a local agent. I mean, I see these commercials rampant. Call the mainland, call them. Even in my business, my mortgage business, there's nobody better than locally right here. We can look them in the face and say, "Oh, I know your auntie, uncle, whatever."
Well, okay, so here, because I do work in different states. Now, what's the difference of someone that you're going to talk to over the phone? Do they stay in touch with you? Do you talk to them every so often? If you call that number they provide for you, will they pick up? Right?
Exactly.
That's the difference. So, not necessarily having, it's always best to have a local agent because they're right here in your backyard. They'll be able to help you navigate through Medicare, right? This confusion that you go through with it all. But if you do have someone that's not from the islands, make sure they stay in touch with you. Make sure that telephone number they give you is a working number for them, because most times they're not.
Are you serious?
Well, no, because they're calling from a call center, and they're not they don't take care of you every month.
When you see these mainland
that.
commercials, it's usually a call center where they have like 10, 20, 50 guys in a room just calling people all day long.
Yes.
And you're just a number. They're really nice on the phone though, but they're only a number. So yeah, it's one of the things I try to tell everybody today, especially in Hawaii, especially the seniors, because they're such targets today. And it's something that I see every week. I mean, I'm on a policy level. I go to big meetings, and I meet with clients every day, on the phone every day.
Speaking about meetings, you're having your Aging in Place coming up.
That's the big one, August 1st. You look in the magazine, the June-July issue of Generations magazine. I think it's our 18th year doing it, or 18th time, because we didn't do it during COVID. Yeah, it's the best workshop. If you've never been to it, call your friends up and check the magazine out. You can go online, generations808.com. On our website, you'll see all the different things. It's the whole all-in-one hotel, mezzanine level, where we have 6 different rooms with speakers in, and every hour we switch out. Then we have close to 50 vendors, private pay, nonprofits, agencies, state agencies. I'll be there. Financial benefits will be there. Akamai seniors will be there. So it's a great resource, and you can talk to people. All the people there are trusted vendors.
Well, and I know that we bring this up a lot. We talk about what's going to be coming up in the near future as far as events for our seniors. And the reason we do this is it's so important for you to take part in it, right? If you have questions, the best way for you to get access to this is coming out and joining don't be shy. Don't be nervous. And that's what I hear. Yeah, local people, they don't want to come out.
Shame.
They don't want to. Yeah, they're too shy to go out and talk story. Let's talk story, guys. But we talk to you about this because we want you to get involved, right? We want you to come down. We can tell you all about it here on our show, but the best way for you to have access is you have to come out, come join it. I know you were saying on our last show that it's grown so much. You have breakout rooms, you have classes.
First year we did it with Kirk Matthews, and so 18 years. So I don't know, 2007, 2008 we started. I can't remember. It's been so long ago. And we had, I think, 300 or 400 the first year. First year we would serve muffins and coffee and everything. Now we don't serve anything. There's people coming in. Every year gets bigger and bigger. Last year we had 1,800 people.
I go for food, not.
This year we'll probably, I would guesstimate 2,000 people. But trust me.
But you said there's coffee
anymore.
Starbucks downstairs.
No,
but go get your Starbucks, go get your cow, and then show up and then sit there and then just be ready to learn. Ready to learn, right?
A lot of information on it. That's why I do if you see the Generations magazine, I do the Akamai Seniors Workshop. So I do a workshop, I lead the workshops, and we talk about everything under the sun regarding aging. So
what are some of the topics that you have?
Well, I have a list
there?
here, which you'll find on the website in my workshop. But
I want you to go through this. So one of the something that he does with you, it's always fun to do like a little game. And so you'll have sheets where you set it out with all of the things that are important to seniors, and you have them circle what's important. It's almost like red light, green light, or Monopoly when you have that and you say, because I know for myself, I'll say, okay, when we go through your plan, here's some money right? Monopoly money, and we're gonna give you some money here, and then we're gonna take money away. Monopoly money, fake money, not real money, right? But it helps them to understand how their plan is gonna work.
That's cool.
Yeah. And then also, like when you, the red light, green light, remember when you were little, you played that red light, green light game?
I was telling my client this morning that I didn't watch cartoons growing up. I was outside in the yard.
You didn't play red light, green light?
No, I didn't play those little kiddie games when I was 7, 8 years old. We were
I still do, and I'm adult now, joking.
No, we were hiking in the woods. I played like an army man, whatever. You know,
Yeah.
I played sports all my life, so no, I didn't really do that, to be honest with you. But I was on the Checkers and Pogo show.
I love checkers and pogo.
My client yesterday of 20 years, her 4 daughters, they go, all my 4 daughters were on the Checkers and Pogo show. I said, wow.
I always, you know what, that jar of pennies, right? It was just that jar of penny, and as a kid, you were like, all I want to do is get on there and get some of that pennies. We didn't even know that it wasn't worth much, but it was the most exciting as a kid. I love that show.
Oh, yeah, I mean.
Okay, now
up
we
in
know how
Hawaii.
old we are.
Well, I mean, it was such an iconic show. I mean, in fact, I have a graphic that has all the shows from the 60s and 70s. Come to my workshop, I'll show it to you. But
going back to that, right? So why do you do that?
Well, because there's so many different things about aging. You know, on the last show I told you that
it's right here.
Aging is not for sissies, and because there's so many things. You know, when I got in this business, I was 42. I'm 66 now, and so I had to learn and get trained and certified and class on this. Well, so I'll tell you right now. So you know what POLST stands for?
No, share
Post?
it. No, share it.
No, I'm serious. Do you know what it is?
No, I don't.
You really? You
I'm
don't know?
serious.
Okay. Well, you're not a senior yet, so. Anyway, POLST. We'll just give you an idea. Post. He goes, oh, yeah, I have a post. No, that kind of post. It's called Physician's Order, PO, for Life-Sustaining Treatment, LST. POLST, Physician's Order for Life-Sustaining Treatment. It's like a medical directive. You know what a medical directive is, right? But this is a portable one. So the hospital, you go to hospital, you're in a hospital, they're looking for your medical directive. However, when you're not in the hospital and you fall down, get sick, you have a heart attack, stroke, whatever, and you're in a public or you're in a house or on vacation, do they know what to do for you?
No.
So legally, they have to revive you. So like in a condominium or your house, the first thing they do when the firemen go in there, looking for the wall of the refrigerator for a yellow-green form. So look at that, do we resuscitate or not? Life-sustaining treatment means basically you're in the ground, you're fainted.
Don't bring me back if I'm going to be mental, kind of thing. No, I'm kidding.
No,
that's
for real.
true. I don't want to. If I'm going to come back as a, not myself, not 100% Angie, I don't think I would want to.
Well,
right? But also don't do it too soon. Make sure.
That's a conversation for down the road. Exactly right.
Yeah.
So you typically will not get that pulse form unless you have some health issues, and you only get it for your doctor. And your doctor signs it. So when a fireman come into the unit, your house, it's a physician's order to not resuscitate or to resuscitate you. That's really what it is.
That's good. That's good.
Yeah.
I like that. I never knew that. So I just learned something
that's
new.
why we're trying to get people to understand is that we want to be your one-stop shop. You can call me, and if I don't know the answer, I'll get the answer. I'll give you trusted referrals, resources out there. Because I've been trained on hundreds and hundreds of different topics. I just started a YouTube channel, I told you. YouTube is /Percy Ihara, and I'll be getting all that stuff up there, and especially all these TV shows, because they will eventually be on the akamaiSeniors.org website, but it's not up to yet. But hopefully I'll get that on my website, on my YouTube channel first. So.
Well, and really, I wanted to, if you don't mind, so on the Big Island, I know it's not here, but if there's anyone watching from the Big Island, that's one of the things that we do. So all of the Medicare brokers, we are insurance brokers, so we do all different types of insurance. But because we have that mindset of being a resource to our community, we're not just agents. We all think of, we act and work as a resource center. So anyone that you come in, and you sit down with them, and that's one of the requirements of the girls when they work in there, and any of our agents that works in our office, is that you're not just there to make a sale. Absolutely not. If someone comes in, they need help, it's your job to find them the resources that they need. So I do love that. Like, you know, and that comes from what you do as well, that one-stop shop. So if you come in there, if you need something, we're gonna look for that for you. We're gonna find where it is, who can we reach out to. A lot of our girls will get on the phone and do it for you.
Well, you told me you go to people's, walk them over to the Social Security office, which is right next to your office.
Yes.
That's great.
Yeah.
Because here, our Social Security office on Oahu is in the federal building downtown. It's not so, you gotta find
Easy.
parking,
Right.
it's a pain in the butt, you gotta walk a long way, hopefully it's not raining, and then you gotta wait in line if you don't have an appointment, hopefully you make an appointment. But here's a little tip for Social Security. So when you call Social Security, it's a toll-free number, and it's always on the mainland. But when the East Coast opens up, they close down. Then the 800 number of call centers done to the Midwest, then to the West Coast. So that when office closes down, the phone is rotated and routed to the next region. When California closes down, it's routed to Hawaii. So right now we're 2 hours different from the West Coast. So by 5 o'clock their time, it's still 3 o'clock our time. So if you call the Social Security office after 3 o'clock Hawaii time, they should have a local person answer the phone.
Well, and nowadays, when you call the Social Security office, you can actually get the location, the office that you're wanting to call. You can find it on Google. And they'll answer that phone, because I don't know how many of you have been on the 1-800, the mainland, the main number, and sat there for hours waiting for someone to pick up. Now, if you call for a local office, they'll pick up within 15 minutes.
Well, that's the big island. Here.
No. I did it with the mainland. You got to call. I've done it for Honolulu, Kauai.
It's not so easy.
So this is something that, and I get, because normally you have just the main number that you call. But if you go onto Google and you put in the zip code of the town, the city that you're in, so if you go to 96814, it's going to give you your local telephone number for the Social Security office here, and they pick up much faster.
Have you called them in the last 2 months, 3 months?
Yes, I do this on a regular basis.
Okay, good.
Yes.
So if you can't get a hold of them, call Angie. I'm not kidding. It's a pain in the butt.
No, it is. I have been on there. I mean, we've all experienced it. I mean, caretakers, we're always having to do a lot of calling, and so I've been on the phone, and that's what made me look these up, because I sat on the phone for over an hour. Yeah. And you just put it on the speaker and let it go, right? And then hopefully someone will pick up the phone. So what I did was I looked into that, and I got a whole list of their local telephone numbers for each office. And they picked that up. Every time I've done it, they've answered in less than 15 minutes.
Okay.
Yes.
I have not had the experience, but okay. Like I said,
so next time, he's going to do it this next time, and then our next show, he's going to come back and say, "You're right." I know.
Because it's the landscape of the political world today, the financing, like you had talked about reduction in certain services, neighbor islands especially, but it's something that we're facing now. And I get calls every week from families that are worried about their finances and worried about, most importantly, long-term care. Dementia is becoming a big thing. I'm not sure if I mentioned it. Well, no, I don't think I mentioned it the last show, but the state of Hawaii is the first state in the country where they're going to allow Medicare, when you go for your annual Medicare, I don't know if you guys know this, your Medicare annual visit, if you're showing signs or your doctor thinks there's signs of dementia, there's actually a blood test that Medicare will take care of. But you have to be referred by a neurologist or your PCP that there are signs that could be dementia. And there's a specific blood test.
And then what will happen with that?
And it will determine the relatively chance of you having dementia. So it's not definitive. There's always false positive, false negatives, but it's something that the Office on Aging helped lobby for.
That's great.
Kupuna Caucus that meets the first Friday of the month, and he finally got the first state in the country. Now, it hasn't been rolled out fully yet, because actually I was at a Windward Mall last week, and the Alzheimer's girl there was there for the state, and she said it's being rolled out, but you have to have a specific condition that is a possibility. Then you're not going to give the test to everybody.
So once they figure that out, and then it's determined that you do have that, and you qualify for the medications that they're
No,
giving,
for the Medicare blood test.
the blood test.
So they're gonna have to. You're gonna have a neurologist study the report, and they'll hopefully gonna give out resources for you.
Oh,
like
okay.
Alzheimer's Association. There's some nonprofits that support patients that have dementia.
So actively getting involved ahead of time. So that's what that will do for.
Yeah, because we're seeing, statistically, I don't know, a few years ago they said 50% of people that actually have it are not diagnosed with it. So when they say there's about 48,000, depending on who you talk to, last number I heard was 48,000, 49,000 people in the state of Hawaii that have dementia. That could mean there's 100,000 people that have dementia, because they said 50% are not documented to have it. So one of the things that the University of Hawaii and Office of Aging did was they got grant money to go out and talk to doctors that they need to do this, and they need to be able to equip seniors or families that have dementia to get the resources.
Well, and
Alzheimer's Association.
that touches my heart, because with seniors that are going through that, being forgetful, not remembering things, they really get so afraid of that. You have that all. I would be. It's not just a matter of forgetting little things here and there, but when they start doing that more, they come into the office and they get confused. We've had people not.
So the next show I think we'll do a whole show just on Alzheimer's symptoms, resources out there, only because
I think that would be
there's
great.
a lot. Alzheimer's Association actually is going to be doing their first caregiver workshop, by the way. Sometime in March or April, I think.
But I want to share, if there's a topic that you would like to hear, please reach out to our office. You can call Percy or myself and just say that what are some subjects that you want to know more about. And Percy, he always says it, he's a one-stop shop, right? He's going to find the resources that you need available. I know in Akamai Seniors, as well as financial benefits, we're constantly trying to be very proactive in your life as far as getting you help. But if there's a topic that you would like, or maybe even us going out and a meeting with Alzheimer's, their groups and their associations.
Yeah, they do a caregiver workshop every week somewhere on Oahu, and I know Neighbor Islands, they have it every week sometimes too, either in person or online. And every family they meet, this week I talked to 3 families that had dementia, somebody in the family dementia. So I refer them out to them and go online, look for their workshops. That way, around other families, just like you, dealing with their loved one that has dementia. And it's so important because it's a long-term disease. I think life expectancy today, when I got in business in 2002, it was 7.8 years, life expectancy.
Right.
Today, it's almost 10 years, like
Well,
9.8.
if you of course you have the patient, the ones that's going through it, but also their family,
It's a
right?
family
I
disease.
know my grandmother had, at her last stages of her life, she had dementia. It was very confusing. It was very frightening for the family. So, being here for caregivers, right? We have so many, the caregivers now are aging in place, right? And they're taking care of their parents that are in their 80s and 90s.
And the phenomenon with that, we're seeing more statistics showing the caregivers passing away before the person they're caring for.
Yeah.
Very, very stressful. In fact, I talked to the family last night. I said, the daughter's taking care of mom. She doesn't have kids, but she's working, but she's taking care of mom. The son is working, but he has 2 kids, so he really can't spend that much time taking care of mom. I said, if your sister gets sick or gets hurt, you got to step up. So you got to make sure you give her rest. Give what's called respite care. Once, twice a week, give her a break.
And the client that I told you that I go into Social Security with her, she's the caregiver for her mother, who's in her 90s. She is in her 70s. And there's so much paperwork as a caregiver that you now have to have done. And that's the reason I went with her too. I mean, I love her. Like, she's my auntie now. Like, I adopted her.
To make sure she documents everything, has
Yes.
a book or a folder with all information.
Oh no, she came into the office. I had called
prepared.
Ed. I was like, Ed, how do I help her? And I'm not going to turn her away. But she literally came in with paper bags of receipts, and you know, because she needed to get some paperwork to Social Security, and she was very afraid of Social Security. And I was like, don't be afraid. I mean, we're going to go over there together. And I took her, and in fact, I was like holding on to her because she just was a mess. She was shaking.
It's very emotional.
Yes.
Very confusing. It's scary. So I try to find other family, neighbors, friends, sisters, brothers that can help out, because she's doing the brunt of all this stuff. Can you imagine if something happens to her at 7 years old?
Yeah.
So yeah, you got to reach out. There's some nonprofits over there. Contact the Office on Aging over there. You really got to provide them with resources. But got about a minute and a half left over. Anjea, any last words?
I just wanted to remind everyone that we are having our senior fair again on the Big Island. We had a very successful one, and hopefully next year we'll have more vendors there for you. It's going to be on Wednesday, September 9th. And then we're going to also have our first senior fair on the island of Kauai on also May 6th. So May 6th on Kauai and September 9th, both Wednesdays. And we chose Wednesdays so that our county can be with us and they don't have to work on their day off.
Yeah, they don't like to work on Saturdays. And I don't blame them. And of
Nobody
course,
does.
the big August 1st Saturday event is a big Aging in Place event. Generations Magazine has all the information. All the issues are on the Generations website, generations808.com. But you can reach us at?
For me, 808-466-1243.
Yeah, and of course, you can always reach me, Google me, Percy E. Howard, 808-234-3117. But also, don't forget, akamaiSeniors.org is our website. So thank you very much. Angie, good to see you again.
Thank you.
Next
Always
time we're
nice
going
to
to talk
see
about
you.
Alzheimer's.
Yes.
Yeah. Anyway, have a great weekend, everybody. Aloha and live well.